now we are moving on to our veterinary segment. It's time to check in with the doctor in Dr. Dog Mom. Dr. Jessica Allen is a traveling ER veterinarian. She's also a dog mom, and she joins us live from Warner Robins, Georgia. Today we get to talk to Dr. Allen about her incredible career, what it's like traveling as a vet, and then we're also going to be doing a very exciting lightning round Q&A. Dr. Allen, thank you so much for joining us.
Hi, I love that video every time with the golden retriever. Not so sure about the glass door. I was about to fall out of the chair.
It was the funniest thing. I mean, with the paw, like, should I, shouldn't I? Should I, shouldn't I? I had a dog run into the glass door at our house, same thing. Like, he just could not get past it for a while, Shaggy, but I'm happy to report he has recovered. But next time, I'll be using the bacon too. I mean, is that not the best? Oh, so Dr. Allen, where did your love for animals come from?
You know, I think it was ingrained in my soul when I was formed. I have always had a passion for animals, and there's really no explanation except for it's truly who I am. It's in there.
That's the best. It just started from a young age and this passion ignited. So no doubt you've bonded with animals young, and it's like when you have that special bond with a pet, there's like really nothing like it. So it doesn't surprise me that you decided to go on and become a vet and work in veterinary medicine. Was there a defining moment when you said there's nothing else I want to do?
I think really the point was I found animals and any type of critter in my yard, and at the time I found it almost derogatory. I didn't embrace it, but they would call me Ellie Mae Clampett because there was always some little animal I had found. And so as far as a career choice, I couldn't articulate the word veterinarian, but I certainly knew that I wanted to take care of animals and make them better and be in their lives and them in my life from the youngest of ages. It's just always been with me.
Oh, that is so sweet. And no doubt you bring that love and compassion to your practice wherever you travel. So we talked about the fact that you're a traveling veterinarian. You're an emergency critical care vet. How did you get into that segment of your industry?
I've always really been drawn to emergency critical care, those a little bit more complex cases. I like puppies and kittens, sure, but just seeing healthy dogs and puppies all day long didn't really push the challenge that I needed. It became a little monotonous for me. And I found that those tough cases that the other doctors may have kind of shied away from, those were the ones that I was really drawn to. Had a little bit of a natural knack for thinking under pressure and realized it was a better fit for me. But being such a stressful part of medicine, it could be something that finding your right, perfect fit, that niche in the world is really hard. And to kind of balance that challenge out, I started spending time in small increments at various hospitals. So I do the Southeast, I do Georgia, Florida, and Tennessee, and I travel to different emergency hospitals to give their current doctors, to give the current doctors a break, or if they're maybe not fully staffed, try and help reduce the burden for a week or so, because we really want to make sure that everybody's getting work-life balance. And so I find my balance by plug and play into different situations, and that helps me to help my peers.
I love that. And a little bit of variety, a little bit of travel, as you said. What are some of the common ailments that you see among animals?
Oh, sure. The most common things that I see in the Southeast are heartworms, and a lot of heartworm non-believers. Trust me, they're real.
Oh,
that
yes,
can be a talk for another day.
But listen to Dr. Allen right now. Go, Dr. Allen. Tell him why it's important.
If you've never seen a mosquito in your house, you're closing your eyes. Even
right.
if your pup is indoors only, heartworm is a really serious disease, and the range of heartworms is expanding. So it's not just Georgia, Florida. Yeah,
yes.
It's something that's 100% preventable. That is probably the biggest heartbreaking news that I have to give is, hey, your pet has heartworms. They're already causing damage to the heart. We need to do something now, but we could have prevented it. So that is the number one big one that's probably the most heartbreaking part
Yes.
to deal with. But I see two other things very commonly, and that's not limited to practicing in the Southeast. We have got a pet endemic issue with obesity. Our dogs, and I'll even see pups, they are massively overweight, and that shortens their lifespan. It's too much pressure on their joints, too much work for their heart and their lungs, and it's just not fair to them.
And what are your top tips for preventing obesity in dogs?
Well, sure, they don't have thumbs, so they're not measuring the food. They're just taking advantage of the situation.
Yes.
Their critical thinking says, Mom gave me food, I'm going to show my appreciation and I'm going to polish that food off.
Right.
So being cognizant of the calories, asking your vet, hey, is my dog at an ideal weight? If not, asking, well, do we need to lose 5 or 10 pounds? Find a goal weight, work towards it slowly. So developing a plan, very, very important. Cutting calories is the only thing you can burn more calories. I know I do. So taking my dog on a walk helps me and my dogs.
That's right. You're bonding. You're both getting your steps in. What's not to love, right? And then you said there's another issue that you tend to see. And what in particular is that third issue?
So the third issue that I see that rounds out the majority of my cases is severe dental disease. And most of these pets have 2 of the 3. They're either going to be overweight and have dental disease, or overweight and have heartworms. So this is not, oh, these are just the top 3. They can happen all 3 together. But dental disease can be really, really sneaky. Our pets are tougher than we are. Their pain threshold is amazing. Their resilience and ability to recover, outstanding. So we can have some really sick teeth, and the only thing that the pet parent might notice is some foul breath. And they come to me and say, Doc, I really don't like how Fluffy's breath is smelling. And I say, whoa, let me show you what these teeth in the back look like. But they have the same problems as us. And we brush our teeth hopefully twice a day, right?
Yes, we better be, right? Yes, if not 3.
And then we go in for those every 6 months cleanings. Well, in an ideal world, your dog will get a cleaning every 6 months too. And we definitely aren't all brushing their teeth twice a day. Most people tell me very proudly that they brush their dog's teeth once a week or once a month. And I just smile because I appreciate the effort. But we've got to step it up a little bit more with those teeth.
Yeah, come on, dog moms. You're hearing it from Dr. Allen right now. We're going to step it up with brushing our dog's teeth. There we go. Tough love. Love it, Dr. Allen. Now, I also wanted to touch just briefly on a sensitive topic that you mentioned when we were doing the pre-interview conversation. And it's really something that might surprise our audience. You said that there's actually a suicide crisis among veterinary professionals. Can you just touch on what perhaps you attribute that to based on your experience in the field?
Sure. It's something that's really important to me because we're talking about it now, but we weren't talking about it at first. And it's time for everyone to know there is a suicide crisis in veterinary medicine. Our patients are nonverbal. We rely on clues, not from the patient directly, to take care of them. Their care is not subsidized. So a lot of times money does play a role in their care. You may have a pup that really needs a blood transfusion. You can't afford that. But I also, as the vet, can't afford to pay for that for your dog to have it. We just don't have those government subsidies. Insurance is an up-and-coming thing. And so as the veterinarian, it weighs just as heavily on us when we can't save every pet. Absolutely. And we also take a lot of the heat for it, that we're only in it for the money. I can assure you no vet isn't.
That is not true. There is no way.
There are 0 vets in it for the money. Find me one and we'll talk about it because I'll help you see that you just got a bad impression. But, I'm not the most articulate speaker. If you are interested in hearing about that topic, there is an organization called Not One More Vet. If you go to Not One More Vet, I believe it's .org, you can see a lot of the supporting factors that kind of have that information that's been well thought together and put out, because it's a topic that is so very sensitive, and a lot of us have lost our colleagues, that I don't want to get too emotional or give morbid examples, but I would love for it to be on everyone's radar. And that's a
Yes.
great source for us to send you to for more information.
Thank you
Or
so
maybe-
much, Dr. Allen. It's so important for us to educate ourselves and also to know that we're never alone. You know, whether you're a veterinarian or if you're watching right now, you're never alone. And I just so respect and appreciate what you do, Dr. Allen, and what veterinary professionals do every day to care for our animals, to come alongside families who feel like they're in crisis with their pet, and also to give pets the care that they need. So thank you so much for what you do. And thank you for wanting to shine a light on a problem. We really so deeply appreciate it.
Thank you.
Yeah, I know that one of the issues that you feel really strongly about as a vet is debunking myths, right? You know, these clickbait articles that are out there about dogs online. I mean, there's just a lot of bad information. We need to do more fact checking, right? So we want to play a game with you, and you're so kind to play along with us. It's sort of a rapid fire question and answer segment where we're going to throw out to you questionable statements, and then you get the opportunity to either debunk or verify them. So you are a trooper, and I'm so excited to get started on this right now. Are you ready, Dr. Allen?
Nervous but ready.
You're ready. I know it. I believe in you. Okay, first question. Do vets know when the owner is lying about knowing their pet's condition? Now, I want to share with you this statement from Phil Zaltzman, DVM, and then you can tell me whether you agree or you disagree. He says, if your dog has a 5-pound tumor hanging from his skin, please don't tell me it wasn't there yesterday. What do you think, Dr. Allen?
Absolutely. Can confirm. We could have been born in a barn, but it wasn't last night. We know that that boo-boo has been there for several weeks. That mass has been growing for a number of days. On the flip side, there are some conditions that really do pop up overnight, but we know those too. So, you know, don't try and sugarcoat for us. It'll only be a detractor from getting the right care at the right time.
Right. Don't put on a show. You can see right through it. Okay. Question number 2. Should owners consider getting pet insurance for their dogs? What do you think?
Absolutely.
Okay.
Yeah,
tell us
definitely.
more.
Yeah, it's up and coming. So some of the programs right now are more of a reimbursement style. So look carefully when you're shopping. You may have to be able to come out of pocket, but they're going to reimburse you for those costs. But it's kind of along the idea that an ounce of prevention is worth a pound of cure. If you're prepared ahead of time, then you won't have to make decisions about money during an already stressful time. So I highly recommend that.
Great advice. Okay, retractable leashes, good idea or not a good idea?
Go get it out of the pantry right now. Put it in the trash.
There you go.
Right
Okay. Oh my. I mean, I imagine.
Firm.
Yeah, there was this funny story. Bernardine Cruz, he's like, you know, don't even go there because, I mean, the thing could break off, the dog could go flying into a car. Anyway, yeah, throw them away. We heard it. Thank you so much, Dr. Allen.
It's the only place for them.
That's the only place. Okay, can raw food diets be dangerous to their owners and children?
Yes, owners, children, the general public. You take your dog out and a senior citizen that doesn't know you pets your pup, and now they've been exposed to some bacteria in the dog's mouth that could be life-threatening for them. It really can be a danger.
There's just such an ew factor there. No. Okay, thank you, Dr. Allen. Now we're going to go to true or false statements, okay? True or false? Cheaper over-the-counter spot-on flea and tick treatments can be extremely dangerous for pets. True or false?
True.
True. Okay, so good to know. True or false? Obese pets usually have obese owners.
That's
True or
a trick
false?
question, but I'm going to go false. Everyone can have an obese pet. At my house, we have ideal weight pets, but a little bit heavy people. So false. Anybody can have a fat pet.
There you go. And should we just pick up the dog food in between feedings, right? That's one way. We've got to minimize it. We've got to do all those things. But I said rapid fire.
If the dog is walked away from his portion, you can pick it up.
There we go. Okay, true or false? Do dog parks. Okay, dog parks. Are they dangerous? Should we go there? Should we not? More risk? They get exercise. What do you think? Good idea or not?
Mixed bag. I say true. I think most vets would say we'd prefer not to take our dogs to dog parks. There are some that do it well, but the overall answer, I think, for most vets would be stay away.
Okay, okay. Now, true or false, healthy pets don't need vitamins?
Healthy pets don't. True. Yeah. If they're a healthy pet on a well-regulated diet, they don't need those extra vitamins and supplements, the money grab from the pet store.
Oh, that's good to know. You're saving us a little cha-ching here. Okay, last one. True or false, can you judge a dog's health by its nose?
False. Old wives' tale. Cold, warm, wet, dry. Type it into Google and you'll get any answer that you want, but that is not a good, reliable way for you to detect your pet's health.
You're just debunking all these myths for us. You're amazing, Dr. Allen. Yay, that was the last one. You made it through it. Woo! All right, way to go, Dr. Allen. Tell us, where can our audience find more information about what you're doing if they want to follow you after the show today?
Sure. I'm a little bit of a social media baby, but on most of the socials, it's at Jessica Allen DVM. But if you want a little bit more of a treat, follow at Miley the Wrecking Dog on Instagram. I have a little smush-faced dog, and she's just a delight. She has a lot more followers than me. I mean, you all can help get me up there. I'd love to work on my presence. But if you want to just see funny dogs and less of the veterinary side, she's a great one to follow.
Oh, that sounds like so much fun. Dr. Jessica Allen, a traveling ER vet, and just a real joy to be around. Thank you so much for your time today.
Thanks so much. I had a great time.
Oh, thank you. Thanks so much for watching this Dog Mom News clip. Do us a favor, be sure to like, comment, and subscribe to our YouTube channel for more informative and awesome Dog Mom News content. And be sure to click that notification bell too to stay up to date with all our new content in real time. You'll also want to be sure to join us for our live stream each Thursday at 3 p.m. Eastern Standard Time. Have a great day, everyone, and we'll see you soon.